not oversimplification. He talked about 5 layers at the top, 7 layers in the middle, and 10 layers in the bottom. So how do we remember these things? We get so confused by the multiple jargons in the temple. So how do I remember it? I want it to be structured, I want it to be organized, I want it to be comfortable. Because the gunshot technique is simple. It's just straight down to the bone, but why are we so uneasy and uncomfortable about it? That's because we know that there are potential complications that can come with that procedure. So how do I do it well, and how do I do it so that I'm comfortable with the technique? And I want you to remember this, 7 and 3, and that's how I remember it. So 7 stands for 7 layers, 3 stands for 3 injection depth, right? So let's go through the different layers together, and I'll repeat it when I'm doing the live demo. Now coming to the infraorbital region. This is 2-point eye lift. I constructed 2-point eye lift about 5.5 years ago when the Density 2 came onto the market. It takes into consideration not just the tear trough, but the infraorbital hollows as well. And again, I'm going to try to simplify the anatomy with you, and then I'm going to share with you how I establish exactly the correct depth of injection, because the most challenging part of injecting in this part of the face is trying to establish exactly which plane you're injecting. So we need to have a safety net, we need to have a checklist. How do we know we are exactly in the right compartment? And this is what this technique is for. And this was constructed out of the desire to avoid as many complications as possible, because we know this part of the face can come with a whole series of complications and side effects. And let's talk a little bit more about the product of 3. That is when the result looks unnatural. For example, if you give somebody too much of a knee version, you are going to give them the ski jump. If you give them too much volume, they are going to look like a rubber duck. And if you give them too much anterior projection, they are going to look as if they've got their face stuck in a window. Alright, so it's the exaggeration of one of the 3 that gives you an imbalanced result that's not natural. So clinician has to always keep in mind, before you even start injecting, that you want to strike a balance of all that. Too many clinicians tend to blame the products. They just think, oh, this product doesn't give me the result, the other product gives me the result. No, it's usually because of the anatomy that is restricting you getting the result you're looking for, okay? So we've got Aksana. Aksana is not bad, right? She's got normal length white lip and reasonably normal volume in the red lip. So she is a reasonably good candidate. However, if you look at the side of her mouth, her lips here, she's got lengthening forward. All right, so camera, zoom out, excellent. Right, now a few things you want to point out to your patients before you start. All right, so Olga shows classic signs of aging. There is translocation of fat pad, there is loss of volume, but very importantly, what's important during your consultation is to point out a few things. If you look at this is what Wolfgang was going on and on about. There is the infraorbital fat compartment, demarcated by, above it is the orbital retaining ligament, and then below it you've got the zygomatic ligament. And if you compare it with the other side, this side is a little bit more severe than the other side. So you want to point this out to your patients, because otherwise they are going to come back to you in 2 to 3 weeks' time. They're going to think that you've injected filler there, especially one side is more severe than the other side. So that's number 1. Number 2, another reason why you have to point it out to the patient is we are never 100% symmetrical. If one side is more severe than the other side, they are likely going to think that you've accidentally injected filler into the other side.
And what is the product now?
This is Ultra D, because it is a heavy-duty product, but you can rely on the viscosity of Ultra D to give you a little bit more lift before you sandwich it with the Arachain. I'm not going to do very much. I can always do a little bit more after I sack her forward. I just want the delegates to have a look at what can be done with combination procedure.
Oh yes, now it's much more
Okay.
clear, yes, and fresh also. The right part is more flat and here is more prominent. Yes, and lifting effect, especially nasolabial and marionette line. Yeah, very, very visible. Even without cream and light reflection.
Right, let's go through it one more time.